lot of confusion these days about what you should do if COVID-19 hits close to home. Someone you live with or work with tests positive. To try and give us some clarity on this, Dr. Ernst von Schwarz joining us this morning. Good morning, doctor. Thanks for being here. Should we immediately get a swab test, or should we wait to develop symptoms? What's the best answer there?
Good morning, Joe. You're right, there's a lot of confusion. So some of the health authorities say not everybody needs to be tested. However, if you are exposed to someone who is positive for COVID, then yes, you should get tested. The sooner, the better. And you should quarantine, meaning stay home, stay in your own room, avoid going out except for doctor's visits or medical necessities.
Yeah, a lot of people have questions about when you should go and do these things. So, Dr. von Schwarz, tell me about taking temperatures. Should we be doing that more often?
Well, ideally, again, if you think you have been exposed, yes, you should check your temperature ideally twice a day, and you want to be a bit below basically the fever levels, below 1 degrees Fahrenheit. You should look out for symptoms. The typical symptoms are respiratory symptoms, as you know, like cough, sneezing, shortness of breath. In children, however, keep in mind they can present completely different, sometimes with just abdominal pain or diarrhea. So any kind of symptoms which are different from your usual normal should alert you, and that would require possibly a COVID test.
What about avoiding contact with other people? How long should we avoid kind of being around others if we think we have it?
Yeah, there's clear guidelines for that. So if you tested positive, meaning if you have COVID or had COVID, you have to isolate for a minimum of 10 days. If you think you have it, or if you think you were exposed, you should quarantine for 2 weeks. So if you had COVID, then 10 days. However, if you have high fever after 10 days, you still have to stay home and isolate. So you have to be 3 days without fever-reducing medications in order to come out of your isolation.
Some good stuff there, and I know there's so many questions about people getting tested and all of that. So when to get a COVID test, some great things there. The 3 things you should immediately know. Dr. Ernst von Schwarz, thanks for joining us again this morning. We appreciate it.
Thank you so much for having me, Joe. A pleasure.